Marketing Officer at Healthcare. Please give a round of applause.
Thank you. So, yeah, my name is Dewa, and I will actually kind of spend the next 1 hour with you to really kind of go through it, some of strategies, operations, what's the future outlook in terms of the career health sector, like the healthcare sectors. So it's very interesting to see everyone because I mean I used to spend 12 years in UK, and in prior to that I was like spent 6 years in Singapore. And looking at like all these diversities, I mean, it keeps me so exciting, almost like going back to school. So, yeah. So before I will actually kind of jump into the session, I will actually kind of share with some of my background. So, let's see. So this is my background. So I'm not pretty sure whether the work I actually do, but I'm currently like working with General Electric as a United States company and working as a chief strategy, marketing, and commercial operations officer. So how many of you actually have heard about GE Healthcare? Raise your hand. Right. Oh my gosh, that's US-based company. That's embarrassing. I need to actually work harder. So GE has been really kind of in the United States for 132 years back, and it was actually established by people that we actually know very well, Thomas Edison. And the work has been really kind of done to healthcare, like the astronaut, aerospace, and there are a lot of like business divisions, and I work for healthcare. So, like in prior to that, I was actually spending like nearly 15 years in a global pharmaceutical company, including Novartis, which is a Swiss company, and Novo Nordisk, the company that we are all known for these weight-losing drugs, Wegovy, and for like the Kid and the Boring Incline, which is like a Japanese and a German-based company. So this is something that I really can share some of the expertise because this is very diverse like experiences I actually had, and it was a lot of like pleasures to working with like different stakeholders. So like the Korean healthcare market is a very exciting market, and let me really kind of share with some of the details in this regard. And like that's just for these professional experiences because this makes the overall sessions quite boring. So for some of my personal interests, I play bass. So on the way to like getting into this venue, I was actually kind of listening to some of the Metallica music, like old 90s pops. And I was really kind of enjoying myself in the martial arts. So I'm the black belt kind of martial arts, sword technique. And if I really have some time, I will definitely demonstrate, but I can actually right. Okay. That's a bit of myself. So for our presentations to cover for like the next 1 hour, we will actually have a global healthcare trend, Korean healthcare landscape, and the digital transformations, and some of healthcare marketing, how the marketing is really evolved for like a number of years. And for the patient-centric approach, this is very important thing. And the Korean kind of university hospitals and some of the general clinics, they are very actively like adopting for this patient-centric approach, and we were really kind of going through an expert on what this really means. And the data-driven kind of healthcare, and there are a lot of investment for the R&D in terms of research, development, and also some of the clinical trials on how some of these kind of healthcare expenditures make into like some of the meaningful kind of data and analytics. And this will be something that like we will really kind of cover. Then the healthcare leaderships, operations, and some of the future outlook. So this is actually the first slide, and I'm not quite sure how much of the familiarities we actually have in healthcare, but if you're actually kind of looking at statistics, WHO has actually estimated for a 10 million healthcare workers shortfall by 2030. So which means we are really kind of shortage for the medical kind of professionals, and this is something that like a very prominent in Korean environment as well. So we are actually kind of seeing the medias and the news, and there are a lot of like healthcare professionals like in need. And there is also a very interesting like instances called the doctor strike, where it has actually happened from the last year, where the doctors from the academia is really kind of looking for the university hospital, and they're starting to actually running with their own clinic. So, which means there are a lot of like shortfalls in terms of the need of the acute medicines and emergency cares. So even when you're sick and going into the emergency department, there are always the shortage of the medical staff to really kind of treat you. And this is really devastating. And it is something that like the government is very actively pursuing to how to increasing with like some healthcare resources for the medical kind of professionals and the medical workers. And in compensation, we could actually see the right side of it, which is the digital health transformation. And this is actually the main theme for today's session, because if you look at for the digital kind of health transformations, nearly 90% of the healthcare executive are actually kind of using these digital tools. And now it has actually kind of become the trend. Then the patient-centric revolution, as I mentioned, there are a lot of patient-centric approaches already being actually starting to prioritizing for the patients rather than the healthcare professionals. So in a traditional approach, doctors knows the best, and we know this from a very traditional generic approach. But now it is more towards with the patient's focus. So that's why the healthcare and understanding of the patient's need and the patient's reported outcomes we known as a PRO, and this has become a very critical kind of important trend for the Korean as well as for the global healthcare trend. Then moving into the healthcare spending growth. So if you look at the rising of the healthcare expenditure, this is no secret, and we all really expect that the healthcare expenditure is definitely going up, and it's not only for this country, but over Asia and the whole regions of the global are actually increasing with the overall kind of healthcare expenditures over 15 years of time. And this is South Korean figure. So look at the South Korean healthcare spending growth from 2010 to 2024. You're actually seeing for the last 14 years, the growth has been almost near to double fold. And for the right side of the planet, you will actually see almost 12.77 hospital beds per 1,000 kind of populations, which is almost number 2, in prior to Japan, where they actually have the most kind of hospital beds, almost 15 per 1,000 kind of populations. For doctors, 2.6 per 1,000, and which is still below the OECD. So which means we need more doctors in this country, and this is where the government is starting to actually kind of raise for the capabilities and the number of the new medical students within the medical schools. But it does actually have a lot of resistance when you actually kind of search on the media. And for the global healthcare quality ranking, we actually kind of ranked for the third based on all the OECD kind of countries. So which means there are a lot of advancement in terms of the healthcare on a growing up business. And moving on to the populations with the national health insurance, because most of almost the 97% of the Koreans are all really kind of covered with the private insurance, and it's a single payer market. So everyone is actually kind of having with this medical insurance, where the patients are only eligible to pay for 10% of their medical expenses. So these are just a little bit of the background, and because I want this session to be interactive rather than me to go through the presentation. So if you have any questions, please feel free to ask, and I could answer based on my expertise. And I was really forgetting for one important kind of comment, because for myself, I'm a medical doctor too. So I was actually practicing in the UK, and where I was actually graduating with the University of Warwick, where I was working as a university physician. And afterwards, I was spending for, let's say, 4 to 5 years in the university hospital working as a staff. And there's a bit of the personal story that I was really kind of coming back to this country to get married. And I'm a father of twins now, and they both are 60.
Congratulations!
Yeah, so a little bit of the dream come true, and working with the head of strategy and the overall marketing, I can actually see these markets are quite fluctuating market, because if you're actually looked at the history of Korea, it is the last 50 years, the country has been very rapidly developing. But if you're already seeing for these rapidly developing kind of countries, there are always pros and cons. And the pro side is definitely there's accelerated growth, and you can actually see if you're just walking out the street of the Gangnam, which is the central Seoul area, you will see a lot of the advancement, and you will see the same, exactly the same within the university hospitals in Seoul. But for the con side, the medical expenses are getting higher too. So it actually kind of creates much more burden for not only for the patients, but for the government as well. So this is something that the university hospital is very actively adopting for the digital transformation, because it has 6 different kind of key pillars. The first one is the telemedicine. If you're actually kind of seeing for the importance of the telemedicine, the geographic area where the people could really access for the medical facilities. They could actually kind of just ring, or they could just kind of set up the Zoom meeting and getting their prescriptions. And this is really important for the people who's having the chronic diseases such as hypertension, diabetes, and even some of the rare diseases. So this is actually one of the areas where the hospital is investing, although there are still some of the regulation kind of challenges that we still need to overcome. AI diagnostics, and this is actually very exciting era for development for artificial intelligence. So how many of you using the ChatGPT every day? Every day. I said every day, and almost half of the people already raised their hand. So which means this will actually become the trend. If you actually if I really come in the next 1 or 2 years time, ask the same questions, probably 70 to 80 or even 90% of you will actually raise your hand, definitely. So this is actually exactly the same for the university hospitals, because some of the major university hospitals, we call this as a Big Five. And these Big Five hospitals, including the Seoul National University, Severance, Asa Medical Center, Catholic, and also the Korean University Hospital. And these five is almost driving the innovations of the rest of the country. And this is where they're trying to really implement with the artificial intelligence diagnostics, where these higher accuracies of the human experts with certain diagnoses, such as X-ray interpretations, and for the pathologies, now it's the machines who's interpreting these images rather than the people. Because for the recent graduate of the medical school, so I'm actually kind of expertise in the medical statistics. So my specialty is epidemiology, which is based on the preventive medicine. But if you're actually kind of thinking about some of the specialties such as radiologies, pathologies, they're not really popular. Because I think it's one of the questions that we could really kind of share to here. What will be the most popular specialties in Korean doctors to choose? Bigger. So plastic surgery, yes, they call it, is the most popular, because if you just kind of walking up the street, you will easily find at least 1 or 2 plastic kind of surgery clinics within the same building. So it's a highly fiercely competitive market, and there are a lot of the Korean doctors are just kind of choosing for either plastic surgery or dermatology, which is another kind of aesthetic, or the ophthalmology, which is the eye doctors. Because usually when people are getting older, they need to actually have a glasses, spectacles, or the lens kind of insertions. And all these are really kind of creating such a revenue, in comparison to some of the pathologists or the radiologists. So, going back to the basic, we are really kind of shortage of these kind of doctors who are actually in a very critical kind of care need. So this is where some of the remote kind of monitoring is actually become popular, because number of doctors will be less, and the demands from patients will be larger. So that's why one doctor to really kind of connecting with the multiple patients based on these kind of remote monitoring, it is something that we are already implementing with some of the beta versions of digital platforms, and some of the startup companies already actually kind of developing with these systems. Then connected care, and usually for the patients wise, these infrastructures of the engaging with the patients is very critical kind of element. And for the university hospital to really kind of maintaining with their reputations and maintaining their source of business, they still need to having a really good connection with their individual patients. But it's not really kind of easy. So that's why these connected care to prioritizing that, at least for the patients to really understand and feeling that they are really receiving the good care will be one of the very important kind of things. And the rest will be the digital kind of healthcare record. Because for the electronic medical record, when I was actually kind of working in a university physician myself, I was always actually drawing things on the paper. And because for the patients' kind of histories and for prescriptions, these were paper-based. So I actually had a lot of paperwork to complete. But in these days, it's an electronic medical record, which is really kind of centralized through the hospital system to storing their kind of patient's data. So this is really amazing. That think about how much of the data has been actually stored with the individual university hospital. So we really understand on how to analyze these patients' data. Then this is actually the key to finding some of the innovative kind of treatment or some of the common patterns, how the patients is exhibiting for their symptoms, based on these kind of rare disorders. Or we could even diagnosing with the patients in a much earlier stage as a high-risk patients, rather than just going into a lot of tests to posing with the money in terms of testing with their blood or testing with their genetic test, and all these could be really safe. So that's why the healthcare trend is now really moving into how we could manage these healthcare records based on our utilization. Yes, please.
In the U.S., the healthcare, we do have digital healthcare records, but they're fairly stratified. Most hospital systems have their own healthcare records, and there's difficulties in transferring those.
Yes.
Is that similar in Korea, or is it more centralized?
So that's a really great question, because first of all, for the Korean itself, we call this IP, like an intellectual property, is actually kind of sitting within the hospital. So which means individual hospitals have a full ownership of their patient's data record. So which means when the patient is going into the individual hospital and take their x-rays, they have to actually have stored their own data into either CD or the USB, and this could actually kind of moving into another hospital to implement it. Otherwise, the data will really get lost. And there are two elements to that. The first one is, if we are centralizing with all the patient's data, which is very convenient, but at the same time, still the hospital system and their policies doesn't really allow. So that's why the disconnection is still existing. And the second is, there are some of the preliminary effort to connect with some of the data in at least 10 different university hospitals. And this is what we call as a Project Odyssey. And this Project Odyssey has a lot of publications already to how to synchronize and harmonize with these patients' record. And still this is very early stage. So this is almost the key element. And the last of them is very interesting. How many of you actually understand that the FDA is recently approved for the Apple Watch to diagnose with one of the cardiovascular disease known as atrial fibrillation? So atrial fibrillation is a cardiac disorder known to causing with some of the heart defect. So it's almost like your heart rhythm go boom, boom, boom. Atrial fibrillation, boom, 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 boom. This is almost like atrial fibrillation. So in order to understand these abnormal kind of cardiac rhythms, now the Apple Watch could detect based on the 96th percentile accuracy. So this is where they get to the FDA approvals to how to diagnosing these based on the screening tool. So this is magnificent because it's not like every time that the doctor will be here with the patients with heart problems, and now these wearable devices are replacing some of these technologies to how to really maintain the patient's health. So this is a bit of let's say, we cannot actually kind of see for these slight small letters, but let me just kind of read it out. So the digital transformation is very schematic diagrams starting from the data collections and analyzing the data. And based on these analysis, it has actually divided into two portions. One is clinical decision support. Second will be the populational health insight. Then based on these healthcare insight, we go with the preventive kind of care model. Let's say screening with some of the high-risk patients at the earlier stage. Then moving into improved kind of patients' outcome as a result. So in a nutshell, we actually kind of making sure that these digital transformations are reducing with the burdens of the healthcare professionals, plus increasing the productivity to giving the benefits to multiple patients as much as possible. So this is actually the digital healthcare in Korea. So yes, please.
Sorry, if I may ask a question about AI diagnostics. So how accurate, right now, how accurate is AI diagnostics on rare disease or rare therapeutic problems? And what is GE's, is GE actively working on this front? If you may share with us.
Thank you so much, Professor. So there are three elements that I will share, and this is another great question. So rare disease is, I think we're starting with the question actually. How many of you understand that how many rare disease cases that we get the FDA approvals in an annual basis? Annual basis, which means every year. How many rare diseases do we have? No. That's, sorry? Thousands. So the exact answer is 7,000. So 7,000 rare diseases cases we're getting approvals in every year. I wish I should actually brought up some of the vouchers or the coupons that I could actually which I always do, but yeah. So that's why we have numerous rare diseases, which is actually beyond the clinical textbook. So, and we cannot actually identify every single of them. But having said that, these AI-based diagnostics, they actually find the patterns. So let's say there are 1,000 kind of patients record, and some of them is actually kind of having, let's say, like the recurrent cold or like a recurrent high blood pressures or diabetes. We could actually kind of combining all these information together, find one common pattern, or we call this as a clinical trait. And this clinical trait is actually kind of leading into the further investigation to identifying whether this is actually a disease of interest or not. So based on like diagnosing with this disease of interest, then we can actually take like the further test to conclude that it is another form of the rare disorders. So that's why like these AI-based diagnostics doing some of the groundwork in a phase 1 to really identifying with some of the high-risk kind of populations. And based on that, we are actually kind of working as a niche market to really kind of navigating through for a specific kind of disease. So it's a bit of the detective work. And once this is almost like connecting to the whole journey, then we actually kind of identify with one rare disease kind of trait. And this is where the university hospitals, pharmaceuticals, all really collaborate to find a cure solution. So this is where some of the newer drug discoveries and the drug development is actually kind of starting their position. So, and before AI was actually implemented, it almost takes 10 years to like finding out one drug to be certified to use to patients. And now these days has been dramatically shortened with the AI advancement. And the expenditures to like developing with one medicine is almost like 1/10 of the cost, which is like compared to traditionals. So that's why it's like accelerating very fast in these current region. And not only for GE, but I would like to take some of the examples from like Amgen or like Johnson & Johnson, like J&J, more commonly. They are very actively investing for like these AI-based kind of algorithms, and they are very interestingly collaborating with like some of the tech companies like Nvidia. And Nvidia's like they are investing so much resources on a drug discoveries in these days. And recursion medicine is actually one of the startup kind of companies now collaborating very closely with Nvidia to finding out like these drug discovery. So this is where like if you're actually seeing for the trend, last 10 years and the next 3 years will be very different. And what I could really tell in terms of like developing with these kind of pharmaceutical landscape. So that's why, like if you're looking at for these digital hospitals, and this is actually the theme for major university hospitals in these days, they're trying to really kind of adopting for this digital model. And as one of the like previous question was already been covered, like the Healthcare 2.0 is actually the paperless healthcare system adopted by nearly 50% of Korea's digitalized hospitals. And this digitalized hospital is a really key theme, and it is actually using it as a really good marketing tool as well. So they're actually kind of using these digital hospital themes to making sure that like they are more technically equipped and advanced kind of hospitals compared to any other competitors. And this has actually becomes more like driving the more market growth in terms of the Korean digital health. So like let's say we are looking at like this left bottom graph for like 2015 to 2025 as almost like the 10 years. And the expenditure, like the growth has been almost like near to the double. So that's why the market itself is really kind of growing market. And if we're looking at the CAGRs for the overall kind of growth rate wise, it's almost like a double-digit growth. So that's why a lot of pharmaceutical kind of companies and the startups are now in this country to making sure that like these could actually kind of drive the overall kind of Korean healthcare market. Then the 5G and the internet is always a critical element. And in order to really kind of understanding for like a specific kind of symptom of the patients and the digitalized hospitals, we need two things: a lot of electricity and high-speed internet. So that's why the 5G was actually the key kind of topic. That the hospital is actually enabled with 5G as a next level kind of high-speed kind of fiber cable to making sure that like advanced kind of telemedicine and remote kind of diagnosis can actually kind of be enabled for like the patient's engagement. So that's why the government has been very actively like promoting for these digital health initiatives. So from 2020 to like 2025, we can actually see launching of some of the New Deal policies in terms of healthcare innovations, and moving on to even earlier this year to increasing the number of physicians 2,000 kind of medical doctors annually to addressing with the workforce kind of shortages. And you will actually see a lot of like news in the media on these debates whether this is really like let's say eligible for increasing the medical stocks or not. And we do not actually find good answer yet. But I mean, we could at least like see that there's a lot of shortage of the medical stocks in the critical care. So it is something that we still need to really kind of address. So this is actually the healthcare marketing, and I will go through fairly quick because like it has already been actually covered in a previous kind of slide. And because these healthcare market is almost like a double-digit growth, so almost 70% of the digital marketing shift is already actually kind of taking place. And it is called omni-channel marketing. So it's no secret that if you're seeing for the portions of the healthcare marketing budget, like majority will be actually using with the social media. Let's say Instagram, Facebook, TikTok. And all these medias are now like using their short-form videos and like advertisement. And it is really drawing a lot of like a new lead in the funnel to like creating the new users. And looking at like the one in the bottom, like the search marketing, so which means SEOs, using with the Googles and like a searching keyword, it pops up as a sponsored link, and all these kind of approaches are something that the companies are very actively like investing on the digital marketing kind of budget. And the content marketing, and like for the people to buy with the product, I'm not quite sure how many of you understand of the buy-in framework. And if you're searching on like the Googles on the customer's mindset or the buying framework, you will definitely see a lot of principles, which is on the sales, like let's say selling skills. And one of the most prominent ones that I would like to mention is like customers does not actually buy the product, they buy the value. So how to really kind of creating these kind of value proposition is always the key. And usually for the customers to like make their decision for the buy-in, it is actually very closely connected to the emotional. Believe me, I'm a medical doctor, so I know this myself. So it is very closely connected to like their emotions to making these decisions. And in order to like moving their emotional mindset, we need to actually creating a very effective storyline. So this is where like I'm trying to really kind of work on the logics. So like at the end, what we needed is a very powerful story to really kind of tell for either the customers or the patients or the hospital stakeholders to really kind of purchase it with a specific kind of product. And this is where the omnichannel marketing is really kind of taking the most effective kind of outcome. So that's why it is really kind of dividing into different kind of pillars. And 83% of the patients' engagement platforms, because if you're looking at for like these digital tools, most of them is custom facing. And these custom facing means either it gets to the B2C kind of model, like a business to customer, and how we could really convincing for these kind of potential customers to either understand, purchase, or like following their brand loyalties to a specific kind of brand or the product, let's say. So this is where like the healthcare kind of marketing is pretty much similar to any other form of the marketing forms, but it is like more specialized in the digital kind of sectors in these days. So that's why what we are really pursuing is value-based kind of content marketing and plus personalization. So this is just one thing that I will actually spend 2 minutes of time, because data-driven is really important, which I already emphasized, and personalization means like in 10 to 15 years of time, let's say at least like 7 years at the latest, there's a drug that we can always give to the patients. So that was quite easy because I used to actually develop it with our own drugs, and when the drug was developed, like let's say hypertension, like to control the blood pressure, you just give to the patients and the patients is receiving their prescription. So that's very straightforward and the easy kind of communication. Sometimes this drug works, sometimes it doesn't, because it's not meant to design for a individual patients. It's meant to be designing for the whole population. But having said that, in these days, and especially in the front of the rare diseases, these paradigms are now really shifting, because what it means is, like the main popular thing is called the precision medicine, and it means, or interchangeably we call this like a personalized medicine. So it actually means like when there is a patient, we actually either take the blood sample of the patients or the DNAs or their kind of history of like the patient demographics, then bring it to the lab, and we analyze these individual patients' data and finding the most optimal solutions that the patients could control their blood pressures. And it often really combines with the multidisciplinary approach called the MDT. So which means there is dietitians coming in, physiotherapists coming in, occupational therapists, medical doctor, district nurses, like all really kind of work as a team for individual patients. So this is actually a very common thing for personalized medicine, because if you're already starting to understand the expenditure of the patients can be really kind of covered based on the insurance. And this is almost like a win-win strategy for the patient side as an end users, like he or she actually get the higher level of their healthcare. So this is where like the understanding of the personalization is actually the key for the overall kind of healthcare sectors, not only for Korea actually, but whole Asia and globally these days. Okay. Great. So yes, please.
Coming back to the personalization part and the AI use, there was this breakthrough in peptide folding where they're able to predict protein folding with AI much with a lot of accuracy. Is that being channeled, or are you working towards that kind of implementation, or is it just has it become economically viable right now?
Gosh, I like this question. So I like this group honestly. So like I didn't expect this level of question because that's purely scientific. So this is what we call this genomics or the proteomics, and there is like a area of expertise. So like if you mention about the peptide, and there is definitely a certain peptide that this could actually kind of work for a certain patients. And usually this costs a lot of like the research and development costs. So that's why pharmaceutical companies didn't invest so much in the last 20 years of time. But now it has actually become like a more popular trend. And we are even like using some of the mathematical models to simulate for a certain peptide to be actually used. Although we have a real library of full of these kind of peptides, but some of them is commercialized and some of them not. And the decisions to make whether this peptide work or not is commonalities. Because let's say, like think about this. There is, let's say, a rare disease kind of patients, which is almost like a 200 patients in overall. And if you actually think about whether these drugs could really kind of affecting for these group of the patients, like if it is just a 10% of 200, then for the pharmaceuticals, it's not cost effective at all. But if this could actually kind of impact for at least 100 kind of patients, which is almost like 50% of the remission rate, of course, like companies could invest for it. So that's why there are a lot of like early stage investigations of the peptide and the protein structures and how these kind of genomics based on the DNA methylations. But still, like majority of them is still in the very investigation stage, rather than the actual kind of ones that we are seeing in the media. But that's a brilliant question. So healthcare marketing career going back, and medical tourism is something that I would like to highlight because like within this country, like after the marriage, and this story continues. And I used to work with the Severance Hospital, which is another big 5 hospital, and I work for the international kind of medical center. So usually the patients that I was seeing is very multinational. So they're with very diverse kind of ethnic groups, very diverse kind of diverse in terms of their background, their educations, like everything's very different. But one thing that they have in common is they are the medical tourists. They're coming in this country for getting their treatment. And like based on the different kind of categories of where they're actually receiving their treatment is like a majority, which is of course not a rocket science, cosmetics. So they could actually be receiving for some of the skin reconstructions, like for the plastic surgery and all that. And orthopedics, getting a knee and the hip replacement, and some of the orthopedic kind of surgery. And for the cancer treatment, some of the innovative kind of cancer treatments, such as heavy ions and also the radiation therapies. Although it is not reimbursed, and there are very few countries which has implemented these early kind of innovative treatments. Then moving on to some of the wellness, getting the quality of life, and also getting to dermatology, like getting into their kind of skin problems. So that's why like the digital marketing approach is very focused on like either medical tourism or the patients who couldn't really kind of afford to have their kind of geographic kind of travel to the actual kind of quality university hospital, but still like requiring for their treatment. So that's why the KakaoTalk and the Naver is one of the domestic platforms that almost, let's say, I was actually back in 97, but it's almost like a 99% of the Koreans using for either form of these kind of platforms. So seeing how powerful this kind of platform to actually kind of drawing the attention of the patients and the influencer marketing. And in these days, if you're actually kind of just open up to the Instagram or the TikToks, there are always the influencers actually kind of giving their comment and the speech and how much of their experiences for a specific brand or the product. And it goes the same to the medicine. So if they really kind of seeing that some of the hospital was really kind of providing good quality care, and they obviously actually uploading for these kind of contents. And sometimes these hospitals are actually kind of provide like making a contract with these kind of influencers or like either the terms like a before service or a content marketing. And the third and the fourth pillar is almost connected to like the digital and the mobility. And the AR and the VR experiences, like virtual reality, augmented realities, it could actually kind of bring down some of the experiences to the patients. And for the plastic surgery, which is a really good example, now they can already see their outcomes before they're having their surgery. Because it's a simulated image that even like ChatGPTs or like Genspark or the pillars, like all these artificial intelligence platforms can actually simulate their image after the surgery. Like if they have the specific landmark, it's very easy to actually kind of navigating through like before and after the surgery kind of thing. So this is where like this is very advanced in terms of like the augmented reality experiences. And the fourth will be the mobile appointment kind of booking. And like not only for newer generations, but even for the older generations now, they all really kind of using the mobile phone to actually book their individual kind of hospital appointments, rather than like just kind of calling. So there's really a demand need for the telephone operators that we used to have, and now it is the mobile, which is actually like very convenient and like set the scene for the patients that whenever they want, wherever they want, they can actually kind of book this. So I didn't actually put down in this slide because it's not something that I would really pursue as being the medical profession myself, but there is something called the medical shopping. So even for the patients living in Seoul or the provinces, when they really kind of suspecting of something which is terrible, let's say like it's not cancer, but let's say highly risk of some of the symptoms, then usually they just kind of enter into one university hospital, coming back, receiving the diagnosis, and like visiting to another hospital to getting almost like validating their diagnosis. So this is called the medical shopping because, like, let's say, how much of the money? I wouldn't really kind of put this in Korean won, but let's say in the USD. So how much money do we actually spend for each consultation in Korea? Does any of you know the answer? I know the foreign exchange rate has been really going up in these days, so I will also recalculate myself. 60? Okay, I'm surprised. Then are we really rich already? So, okay, that must be much like lower than that. 20? Yeah. Lower than that.
Free.
Lower than that.
Free.
Sorry? No, it's not free. I wish it was free already, but I mean, it's not free.
$5.25.
$5 is close. 25, it is slightly higher than 25. It's not slightly, but it's higher than 25 cents. The exact answer is $3.
Wow.
Just for getting a consultation. You see, I already actually mentioned at the beginning of this session that I'm a father of twins, isn't it? Like both are 6 years old. And they're always having a cough and the symptoms. And when I actually bring them to the pediatric clinics, how much do I pay? Less than $1. Because like they are twins and we are born as a little premature. So it's almost like a 3% of the overall medical expenditure, including the medicine, has already been covered from the government. So this is magnificent, isn't it? But at the same time, think about on the other side, like for the medical profession wise, there are a lot of like work burdens because even for the patients who does not requires the treatment, that's really the important thing. Because when I was in a UK doctor, I never prescribe the antibiotics for the patients just for having a common cold. It doesn't really make sense because you can either take a hot tea, lemon, and like a ginger, or workout. This country, 7 different combos for like treating with common cold. So there's always a downside of it. Not only for like getting the improvement of the patients, but the overall kind of cost of the medicine, which is to really kind of sustain the business. So there is always like a dark side of it. So that's why the patient-centric kind of healthcare. And patient-centric is already something that like I was kind of covered like quite frequently through the earlier slide. So the benefit of the patients in terms of the patient-centric approach is very clear. So patients is getting the better treatment and the better cares, and the benefit for the healthcare organizations to reducing the hospital admission rate and also some of the emergency visits. And as I already mentioned that this country is very shortage of the emergency and the acute kind of cares. And this is actually kind of becomes more helpful for the patients to reducing these kind of emergency visits. So the patient satisfaction is something that I would like to pursue because this is traditional approach and this is patient-centric care, like a patient-centric approach. Patient satisfaction is obviously like going up and the clinical outcome is much larger compared to the generic and the traditional approach. So how to implement it? So this is like everyone's job, and university kind of sector are already actually kind of forming a dedicated team. Like I already mentioned this word, MBT, multidisciplinary team. And these kind of teams are the group of the expert who's actually kind of looked at for very specialized and personalized medicine for these kind of patients, and also making a aligned or the shared decision-making process. Then the transformation in terms of the culture-wise. And one of the most challenges that the Korean university hospitals now face is the digital literacy. And what it means by, like, let's say the definition of the literacy is understanding of like the knowledge and awareness level. And like the technology has been very rapidly like developed, but in terms of humans to follow, it's much slower. And it's very obvious because for the medical professionals to seeing the patients, like let's say 30 patients in the morning and 40 patients in the evening, and believe me, I used to treating with these 70 patients in a day. So we didn't actually have much time to spend in terms of understanding the algorithms, logics, in terms of the digital and the technological advancement. So this is where like technology is there, but in order to using them is really lag behind. So this is very easy. Like if you're really buying for the new iPhones or the Samsung Galaxy, how many of you really understand the complete function of it? No. We only use for like a phone's text message and social media. Usually that's the main source of like our understanding of these kind of access. Same goes to this medical technology. So a lot of startups are offering for their new innovative digital AI solutions, but the penetration rate from the hospital itself is very low or like a very medium poor. And one of the main reasons is they cannot actually kind of take up these kind of advancement level of technology based on their current level of understanding. So this is where like the patient-centric approaches, we need to actually kind of transform the overall culture of the hospital and infrastructures, including like these cultural elements. Okay, so and the data-driven I already covered. So in terms of the healthcare leadership-wise, this is probably like some of the last slides that I actually have. But we need to have like these 6 different key pillars. So the first thing is the strategic vision, and because in order to really kind of become more leaderships in healthcare spaces, we need to really kind of set the clear vision to making sure that what is our directions to pursuing and moving through. So let's say one of the very interesting kind of slogans that I have seen was one of the pharmaceutical industries called like let's say 25 into 25. So which means they want to actually kind of bring up their kind of business revenues, $25 million USD by 2025. So this kind of simple kind of things really kind of work out. So these sort of visions, like strategic visions, actually kind of bring to a footprint in terms of how the business could actually kind of evolve and develop. And the second is the operational kind of excellence. So optimizing with these kind of healthcare resources is very critical key. And usually like these data-informed decision-making process, because for like, let's say data was analyzed by the AI and giving them like a certain diagnosis. But in order to actually kind of understand these diagnoses from the healthcare kind of profession, it's really important to communicate clearly with your patients. So like these data-driven kind of decision making is something that like really increasing these operational kind of excellence of individual hospitals and the change in management. And I'm actually still thinking that this country is in a transition phase, and we are actually kind of moving from this traditional approach to like this digitalized kind of environment. And this is where the hospital needs to be like a more understandable in terms of the adaptabilities to evolving with these kind of healthcare landscape. Then like overcoming the resistance based on this kind of current and the traditional engagement. For last three will be like quite connected to each other. So one is the training of the staffs, and this is where like GE Healthcare and other pharmaceutical companies are very actively like engaging with the university hospitals, make partnerships, collaborations, how to train the staffs in terms of like getting into their digital literacies. Then moving into like this care quality focus, because this is evidence-based medicine in these days. We call this EDM, and evidence-based medicine is very important. That like it's not something that you have a cancer, but it's something that you have a suspicious genetic trait of A, B, and C. And based on our kind of examples, you have a higher probabilities to getting into a form of solid tumor, which we need a additional investigation. So these are actually the work of using the medical doctors now communicate to the patients, rather than just kind of, let's say, dropping the bomb to the hard kind of diagnosis. So this is where the care quality focus to really kind of putting the center of the patients is everything. And then lastly, the engagement of the different stakeholders. So my job here is not only for actually like setting the clear visions or the improving with the operational excellence, but I also meeting with some of the politicians, payers, and the policy makers to making sure that they are also really understanding on the current challenges that this healthcare environment is facing, and how we could really kind of work and bring collaborator to like bring up the business. Yes, please.
Hey, so I'm not sure if I'm jumping ahead here, but so fascinating depiction of a new world digitized healthcare ecosystem, right? So can you share with us a little bit where's the value capture, meaning where's the fattest part in this ecosystem, and where is GE targeting in this whole, everything is changing all the way from drug development all the way to the front, digitized marketing.
Yeah.
So where's the fat and where's GE in this whole picture?
This is really great, because the whole session here today is to really giving the education session rather than the promotion session myself. So I was trying to really minimize the GE much as possible, and I was really kind of putting up the head of the medical profession here. But if you allow me, like it's not only for the GE healthcare, but majority of the companies are actually dividing into the two pillars. One is the diagnostic area, like how to getting the most accurate diagnosis of the patients. And it is really like, let's say, upset when the patient was misdiagnosed with something, like one that they are actually kind of suffer for a number of years, believing that they actually have a certain disease and it was not. And it is very disappointing, isn't it? And that's why we need to really kind of finding out the accuracies in terms of like this precision medicine for their diagnosis. Second is the treatment, where the pharmaceutical companies are actually kind of developing their own drugs to treat the patients. So GE Healthcare is on the like the first group, so which is actually for the diagnostic space. So we are actually having the most FDA approvals, almost like more than 750 FDA approvals in a yearly basis. And we are the top of like all the global worldwide kind of companies for the AI solutions. So we already actually synchronize all these. So which means we already actually creating the system called the Edison, and this Edison system is actually connecting the patient's electronic data, patient's kind of demographics, all these kind of patient's kind of informations. And we already actually kind of having our artificial intelligence system to diagnosing these kind of patients with 99% of accuracy. So we do have these solutions, and we already actually kind of work quite closely with the university hospitals to like making sure that their expenditure is actually lower in terms of healthcare kind of burdens for these kind of radiologists and like healthcare specialists, like their times and their energy, and at the same time giving them like a more productive time and becoming like themselves as a digital experts rather than like us to be an advocate. So this is where like we are actually connecting these things, like the nitty-gritty part in the book. Okay, right.
One more. You mentioned the lower cost of consultation. Is the healthcare industry working more strategically with the government, especially to focus on the declining population rate and like your demographic is aging very fast. So are there any strategic healthcare services in that way to preserve the population? Because it's pretty daunting to see that graph.
I know. Actually, like almost like a dinosaurs, our local population is diminishing at this point, even like the time that we speak. Because by the time of 2050, our whole population will be actually kind of dividing it, almost like reducing it to half. So this is really, really like a scary kind of point for us. So how to increasing, like how to manage with these kind of aging populations. So that's why there are some of the policies that the government is actually kind of encouraging. Let's say, like free of the medical expenses for the patients over 65 years old. That's first. Second is how to create the medical town or the medical specific kind of infrastructures where the silver age, which is like 60 to 70 age typically, they actually kind of receiving the full care of their services, but this is based on their own expenses. So I'm not quite sure whether this is really effective for the general population. So there are a few things that the politicians and like policymakers are still like recommending, but like the effectiveness or the outcomes we still need to actually find because the time is actually kind of proving that it was right or wrong. So that's another really good question, and I felt like you were raising it too.
Yes. So
Yeah.
how? Yeah, a lot of this seems great, and I'm wondering how it seems like it's very urban centric. So I'm wondering how you manage taking care of rural communities in Korea.
For communities.
Yeah, for more rural communities.
Oh. Okay. I think like let's say it is how we define rural. Obviously, that's starting with the definitions. So Seoul is the capital area where the 70% of the population is lived in. So another 30% is lived in the province area or the rural. But usually for the rural areas to getting their medical support or access is always very challenging. So that's why for like government to pursuing for some of the university hospital side, they assigned these hospitals as a center of excellence, or the known as a COE. And these COEs, like the patients are actually kind of travel to at least their province kind of COE to getting the right level of the treatment. Like let's say if they require for the tertiary cares, like something which is quite serious. And for the mild to moderate kind of thing, like for the daily cares, usually there is a public kind of healthcare sectors that they could actually getting their treatment for free. But in terms of the medical staff shortage, it is not really kind of fully operational. So like I was a bit hesitant for this response because there is a huge discrepancies between the rural and the central area. For central areas, 2 plastic surgery clinics, 1 building. So I really shared, or even like a 3 to 4. But in terms of the rural areas, you walk for like miles to actually finding one small clinic. So this is still the reality of this country, and we need to actually kind of do something to how to overcome. Please.
The idea of interacting with AI to validate a diagnosis or maybe talk about a physician to validate a diagnosis is very interesting. It sounds similar to something we do with all our second opinion, but we operate in a gray area where we don't actually practice medicine. So, is it the same here? Like if the AI makes a diagnosis, is that carry the same weight as when we see a physician, or they get prescriptions and things like that?
It's really brilliant. So like let's say at this point of time, still we are thinking that AI is a supporting tool rather than like replacing the diagnosis. So what I mean by like supporting of these kind of diagnosis is it is definitely like giving the second-hand kind of opinion, but at the same time doing some of the ground jobs. Like let's say when we are actually kind of seeing the patient for like first 20 to 30 minutes, then we can actually get the sufficient amount of the information to make diagnosis. But in terms of the Korean doctors, the standard time to actually seeing the patients is less than 3 minutes. So we cannot actually kind of collect all these required information. And this is where the AI is really playing in, because the X-rays that they used to take and some of the CT image and the MR images, now the AIs are actually kind of interpreting these kind of images and giving them like some of the preliminary kind of asset. And based on these kind of let's say, the processed kind of analytics, medical doctors are actually kind of make the right kind of choices. So this is almost like the two-track work, rather than like solely depending on the AI, because this is still like a little bit too risky. Because even for like decisions to when to take a surgery, and we cannot just kind of rely on the AI to, let's say, this patient's required for the surgery in next 1 or 2 days. Rather than that, we actually need the surgeon to definitely stay in, understanding these data, make sure that this AI is actually kind of giving the right diagnosis. But this is definitely a good question.
You mentioned that there's some difficulty in implementing this, a lot of the technologies in hospital systems and a lot of resistance. So would you say that's more from the providers or the doctor standpoint or from hospital administration?
Yes. So because I think you might actually see in the news media the re-election will actually take in June this year. So it's only like 2 weeks left. So I wouldn't technically mention too much about the politics and the politicians, but like let's say it's about the culture. I must say, because like some of the policies which we used to actually kind of operate, and it works quite well actually, like compared to 10 to 5 years of time. But what we need in these days is a little bit of the change. But like still for the people who's making the decisions, such as like these politicians, the policy makers, like they are still like quite, let's say, not so sufficient level of the digital literacies as what we really expected. So this is where we are actually kind of having a regular session to make sure that their insight is up to the speed. And based on these kind of insights, we could actually kind of proposing with some of the projects to collaborate. And that includes some of the medical access that covers for the rural areas that you have mentioned. Yeah. Yes.
And then, as part of your solutions for digital healthcare, have you all thought about not just connecting patients to physicians, but physicians to physicians? So your primary care, instead of referring someone else to go see a specialist, instead they can communicate with specialists directly to get what little information they need, and then so they can continue to treat patients.
Yes, that's the next stage. Okay. So usually the phase one is like when I say patient space or the patient-centered approach. Second is connecting the peer groups. So what I mean by the peer group is medical profession to medical profession. So this one of the perfect example is when the patient is actually suffering from diabetes for the long term, let's say 20 years of time. What they need is a dialysis. And in terms of setting up the dialysis scene, we need like one profession called the endocrinologist, which is actually a doctor, like hormone doctors, to actually kind of infusing with these diagnosed like dialysis. Then on the other side, we also need the kidney doctors called the nephrologists, who need to actually kind of look after the patient's kidney to make sure that these dialysis doesn't really kind of harm the patient's kidney. So like these types of communications requires a lot of seamless kind of interpersonal, let's say, connections. And these AIs are now actually enabled. So one of the hospitals, I'm pretty sure this is still like at the pilot stage, but one of the hospitals was actually having these pop-up screen. So when the patient was actually kind of requiring for a multi-specialty kind of care, and it usually pops up like which doctor to consult, which doctor to actually contact to which one. And all these are actually kind of providing almost the spider web like the network. And this could really kind of work out for the individual hospitals at least. But like having said that, still like the communication between the hospital itself, between the medical staffs, we still need to actually kind of making sure that there is more time to understand and think about, rather than just kind of seeing the patients in a very short term. It's quite stressful work. Like if you're seeing the OECD kind of stressful kind of chart, like a medical doctor is usually like on the top rank, and because the number of the patients they are seeing, like if you think about if you have to speak to 70 random people, you don't know who to enter into your clinic group anyway. And if you're actually kind of doing this for whole your lifetime careers, like think about how much of the stress that you will receive. So this is where like we need to really understand on how to actually buy in for these kind of time for the doctors, making sure that this network is actually kind of really helpful for them. And it requires a lot of like a continuous education. Yeah. Please.
With all the rare diseases that you said, like at least 7,000 odd that are coming up every year, I'm sure like G cannot keep up with finding diagnostic methodologies for all of these. So does G Healthcare kind of identify startup partners that are kind of focusing in on a particular rare health like health disease and kind of partnering with them? What's the scene around that?
Absolutely, indeed. So there are two ways that let's say the big pharma, big kind of global companies are actually kind of collaborating to finding out, dealing with the rare diseases. In a simpler way, the first thing is definitely the partnerships. So you did mention about some of the startups and the third parties, and we usually actually make a long-term contract on their services are really kind of meaningful to find out with either the new disease or the new treatment solutions. And based on these kind of outcomes, we are actually kind of expanding these kind of partnerships to making sure that this group brings to the commercializations, because commercialization is always a very different story rather than the drug discovery wise. So that's why for some of the global companies, I can even name IQVIA is one of the global kind of companies, very worldwide known, and Illumina is another one, which is very a known genetic company. And we also have a Tempus, which is very goes up. So if you're already actually having the Tempus stuff, you will go skyrocketing kind of shit. And all these kind of companies are actually kind of providing a lot of values with collaborating with the big pharma. Second is the merger and acquisitions, M&A. So once they have their proven method of a treatment, then we just kind of find the companies. So one of the good examples is one of the companies that I used to work with, Hida, which is actually a Japanese company, but their headquarters in Boston. And when I was actually working as a strategy leader, we actually deliberately make these choices to acquire with one of the company called Shaya, which is rare disease company in based on Ireland. And that's why after the merger, Takeda has actually become number 8 of the worldwide companies based on these technology and the diverse kind of portfolios. So this is one of the strategies that really exploiting to how they're expanding with these kind of businesses of the rare disease. Yeah. And now the companies are actually more focusing from, let's say, the common diseases to the rare disease problem. So this is very pertinent kind of area, moving through.
Okay, I think we have time for just one more question.
Yeah, and this was my last slide too,
Oh,
so
perfect.
I think it's a perfect timing. Yes, please. I think we can take 2. Yes.
Oh, okay. This is just more personal. The transition from going to practicing as I said, to going to more business focus, what sort of drove that, and I guess what are the challenges that most been beneficial from having that medicine and expertise in the medical field?
Can you actually answer the first question?
Yeah, just what drove the decision and the process from moving from medicine to business side? More.
Oh, a bit of personal to me. Actually.
Yeah.
Okay. Right. So I like this one because do you all use LinkedIn? The social media. So I just mentioned about the influence marketing, but I'm also one of the influencers myself. So I ranked number 13 of top 20 in this country for last year's statistics. Wow. So that's why I usually share with my life stories with that, and I also wrote my own book. So I'm a book author myself. So the reason that I was really choosing from the medical part to the this business-wise, there are a few things which was highly impacted on my decision choice. The first thing is definitely marriage. So I was very successfully actually leading my career in the UK, and as you are seeing from my tone, I like to interact with the people. I don't really mind seeing the 70 patients in a day. So that's why I was actually kind of continuing with my career. But after meeting with my wife, she is a government officer, by the way, so she can actually move abroad. So I was actually kind of deciding myself to coming in, and as same goes to all the Korean males, if you're actually coming back, you need to serve for the military. So I was working as 2 years in the military medic myself. So I was not just kind of equipped with the stethoscope, but I was actually kind of working to seeing some of the infantry units to taking care of their wound. So after 2 years of time, I was actually kind of trying to going back to the hospital, the severance. But let's say the resignation date from the National Military Service, I completed this service in July and used the hospital to recruiting with the new medical staff was in January. And I was so eagerly to actually kind of marry with my wife, and I didn't have much money. So what options do I have moving into the business? So I was applying for the same job, and very interesting, I was applying for 20 to 30 different pharmaceuticals. None of them is actually even accepting for the interviews, and I was so wondering because I wasn't in the right fit at the time, and I was applying for the R&D job, and I was immediately going right into the this pharmaceutical company. And after 14 years of time, I was working as a C-level. So this is a bit of my life story in the business. business, and I enjoy business because when you are within the medical expert, I still like embracing that there are a lot of hard work, the dedications from the medical professionals, but we are actually seeing the patients in the one-on-one. So there is very limited influences that usually the 95% of the medical professionals can. But if you're working in the industry and the business, you can actually kind of change the community. You can change the society. And like the people that I actually meet, the key stakeholders, policymakers, politicians, then we can actually change the world within a better place where the patients could actually receive the right level of treatment. So this is a bit of my commitment and a little bit of the responsibility I was going to say. Yeah, but thank you. I don't mind sharing with my personal story, honestly, because that's already been really posted on the LinkedIn. Yeah. Any other questions?
Good. All right. Well, thank you. Talk soon.